Hello friends, today we'll be talking about, in brief, about liposuction. The first point that is to be noted and need to be understood by all the patients who are planning to undergo liposuction is that liposuction is not a weight reducing procedure. It is a body contouring procedure. That means we need to understand the weight reduction. It comes as an added advantage to the removal of excess fat that is there in our body at unwanted places. Unwanted places, that means we can come to know, or we can see ourselves in the mirror and we can judge ourselves what are the unwanted places. Unwanted places like this is under aspect of the chin. This is there, then the medial aspect of the arm is there, there is a laxity of this, there is a hanging or there is more amount of fat, the abdomen part, the love handles, the medial aspect of the thigh and certain aspect of the back. These are certain parts which undergo liposuction and the excess fat is removed. For removal of this, we use Tumescent solution. It is composed of multiple amount of drugs including IV fluid, and adrenaline is used, and soda bicarb, and along with that we use kenacort and certain other drugs are also added. For this, because of this Tumescent solution, the fat get dissolved and it breaks down, and then we are able to do suction through our liposuction cannulas. Simultaneously, if in patients, if they are interested in undergoing excision part, we need to understand this, because if this part is there and we undergo liposuction through this, there is some certain amount of laxity is still there, patient wants, then we do perform chin tuck also. But that all needs to be counseled and patient needs to understand these things, or if they are interested then we need to talk about this pre-operatively. Otherwise liposuction is there and we perform liposuction, then we give pressure garment for this, so that this skin which is laxity is there, it gets stuck to the under aspect. Simultaneously, for this part also we can perform liposuction, removal of excess fat, and if more amount of skin laxity is there, and particularly in those patients who have undergone a massive weight loss or elderly patients, for these patients we remove this part of the excess skin also. Along with this, for abdomen part we do perform liposuction, and if there is excess amount of laxity of skin, we perform tummy tuck also. In tummy tuck, what we do, we remove the excess amount of skin and fat, and depending on that whether the umbilicus position changes or not, it depends the amount of skin and fat that we are removing. So in most of the cases it is decided pre-operatively, but in certain cases it is decided on the table whether the umbilicus position needs to be changed or not. It varies from patient to patient. Along with this, once the surgery is performed, we mostly discharge the patient after 2 to 3 days. On second day the dressing is changed. If there are lot of secretions are there, we can come to know on this on pre-operative or mostly in the intra period only. We put Romovac suction drains. Those are removed in 24 to 48 hours, and depending on the drainage amount of seroma that is being formed, we do remove the drains in mostly in 48 to 72 hours. After this, once the surgery everything is done, after removal of drains, the patients are discharged along with the pressure garment. Pressure garment needs to be worn again for 6 to 8 weeks at least, and then the exact result that comes after liposuction is evident approximately after 3 to 4 months. But the weight reduction will take much more time. It will weight reduction because of the fat, because a certain amount of fluid that we give in Tumescent, it gets absorbed in our body, and gradually it gets removed from the body, and so along with this the weight reduction part that will be more evident after near about 4 to 6 months. So we need to understand this thing, that liposuction is a body contouring procedure and not a weight reduction procedure. Thank you.